probably never thought about what life would be like if you had over 20 lesions on your brain and over 20 lesions on your spinal cord. 4 years ago, my life changed in a very dramatic way, and I knew that my life would never be the same again. 4 years ago, I got a call from my dad when I was staying the night with a friend, informing me that my mom was in the hospital. She'd been having some really odd symptoms, and so they did an MRI, which is just basically a scan of the brain. And the scan showed over 20 lesions on her brain and over 20 lesions on her spinal cord. And then he told me that my mom would likely be diagnosed with a terrible disease by the name of multiple sclerosis. I thought to myself, and I asked my dad, lesions? Like, what does that mean? Is that like cancer? I don't understand. Many people don't know what MS is, and so today, my job is to inform you on what MS is, who it affects, and the types of treatments that are available. We will begin with what MS is. It's an unpredictable autoimmune disease that causes demyelination of axons in your central nervous system. Your central nervous system is composed of your brain, your spinal cord, and your optic nerves. So basically, you have neurons in your brain, and their projections are called axons. Protecting your axons is a substance called myelin sheath, and it's basically an insulator for your axons, and it provides like a cushion, kind of, and it helps your signals to be transmitted. Without the myelin, signals are distorted and slowed. The immune system in MS will mistakenly attack the myelin sheath, and it causes motor deficits, neurodegenerative effects, etc. MS is a chronic, often disabling disease, and symptoms may be mild or severe, like you can be paralyzed, you can lose your vision, but the progress, severity, and the specific symptoms of MS are unpredictable and vary from one person to another. And basically, on the molecular basis, the depletion of the myelin on the axon is what causes signals from your neurons to be slowed and distorted. There are 4 types or courses of MS. The first type is relapsing remitting, and this is the most common type. People with this type of MS experience clearly defined attacks of worsening neurologic function. These attacks are called relapses, and they're typically followed by partial recovery periods, or what we call remissions. The second type of MS is primary progressive MS, and this disease course is characterized by slowly worsening neurologic function from the beginning with no distinct relapses or remissions. And this one's more rare. Approximately 10% of people with MS are diagnosed with primary progressive MS. Secondary progressive is the third type. In secondary progressive, it initially looks like the patient has relapsing remitting MS, and then some of those patients develop a secondary progressive disease course where the disease worsens more steadily with or without those occasional flare-ups or remissions. And then the fourth type, the last type of MS, is progressive relapsing, and this is the most rare. Only about 5% of MS patients have progressive relapsing. And in this disease course, people experience steadily worsening disease from the beginning, but with clear attacks of worsening neurologic function along the way. And they may or may not experience some recovery following these relapses, but the disease continues to progress without remissions. So in your central nervous system, you have these special myelinating cells called oligodendrocytes. And if these cells are attacked by your immune system, they will not regenerate. And typically, you do not have immune cells in your brain. You have resident macrophages in your brain, but not your white blood cells. You don't have those in your brain. And researchers today are investigating the phenomenon of how immune cells infiltrate the brain, because they're not supposed to cross the blood-brain barrier. And so they're studying to see how T cells, which are a special type of immune cells, are primed to cross the blood-brain barrier. And they're studying to see if it is actually those T cells who are causing the destruction of the mature oligodendrocytes, which would thereby destroy the myelin sheath. So what are the symptoms of MS? Symptoms of MS include partial or complete loss of vision, usually in one eye. Often there's pain in the eye, which is referred to as optic neuritis. other parts of the body. A lot of times, MS patients experience electric shock sensations that occur with certain head movements. Many MS sufferers have tremors, uncontrollable tremors, lack of coordination, unsteady gait. So like when you watch them walk, you can tell that something is wrong with their motor coordination. A lot of times they lose their balance really easily. Many have slurred speech, or they might not be able to think of the word that they're trying to say. Dizziness, fatigue, those are also symptoms that a lot of MS patients have. So after hearing this speech, if you're scared that you'll one day have MS, you can't just go to the doctor and have them tell you if you're going to have MS or not, because it's unpredictable. And according to the National Multiple Sclerosis Society, MS is thought to affect more than 2.3 million people worldwide, 400,000 of those residing in the United States. So who then, among that 2.3 million people, does MS affect? Well, it affects men and women, commonly between the ages of 20 and 40. However, women are about twice as likely to be diagnosed with MS than men. Caucasian people, particularly those whose families originated in Europe, are at highest risk of developing multiple sclerosis. People of Asian, African, and Native American descent have the lowest risk. MS is far more common in areas like Europe, Canada, the U.S., and New Zealand, as opposed to other countries. And recently it's been shown that a deficiency in vitamin D has been linked to an increase in the risk of MS. So drink your milk. Your personal medical history of certain infections or other autoimmune diseases affect your risk of developing MS as well. Scientists now have even created a transgenic mouse model that represents MS, which is pretty cool. Dr. Tara De Silva in the Physical Medicine and Rehabilitation Neurobiology Department at UAB, she came to one of my colloquium classes a few weeks ago, and she explained that the research she's doing in her lab is studying to find the underlying mechanisms of how Th17 cells, which are special immune cells, are directly destroying myelin. So they're trying to understand more about the molecular basis behind the disease. According to physicians from the Mayo Clinic, if one of your parents or siblings has MS, you have a 1 to 3% chance of developing the disease as compared with the risk in the general population, which is just 1/10 of 1%. So this means that my risks of developing MS are greater than that of the general population, which is not necessarily fun to think about. MS not only has physical effects, but has cognitive and behavioral effects as well. It's a particularly debilitating disease, and it often causes depression in patients. Can you imagine being diagnosed with MS right now? You're in college, so you're probably at or around your 20s, which is a common age for MS to develop. I really can't imagine being diagnosed with MS. It's a terminal illness, and I honestly don't know how I would face the future with such a terrible disease. MS can often cause severe psychological trauma because of its effects. Many MS sufferers lose their jobs, their ability to read, or to even carry out everyday normal tasks. So now that you know the basics of what MS is and who it affects, I'm going to tell you a little bit about some of the treatments that are available. MS has no cure, so treatment usually focuses on strategies to treat MS attacks, manage symptoms, and reduce the progress of the disease. The most common strategy to treating attacks is treatment with corticosteroids, which are mainly used to reduce the inflammation that spikes during a relapse. Some strategies to slow the progress of the disease include beta interferons. That's just a word that most of you probably don't know, but basically it's a really popular treatment, and it's used in an attempt to reduce the number of attacks and lessen the severity of the attacks. So none of these medicines are going to be able to stop MS. There's no cure, there's no way to get out of it. But this medicine can try to lessen the severity of the attack. So maybe the attack won't be as bad as it would have without the medication, or it can lessen the number of attacks. But these interferons can cause serious side effects. A new drug called Gilenya, it's come out in recent years, and it's an oral medication, which is really nice. And it works by trapping immune cells in the lymph nodes so that they don't get a chance to cross the blood-brain barrier. Another famous but aggressive drug is called Tysabri, a treatment typically reserved for MS patients who see no results from other types of treatment, so it's basically like a last resort. This is actually the treatment that my mom receives. The Tysabri is administered through an intravenous infusion, so just an IV infusion once a month. It takes a number of hours to complete, but it attempts to reduce the number of MS attacks by interfering with the immune cells. Tysabri tends to weaken the immune system, so typically if a patient has been on Tysabri, his or her immune system is weakened, so he or she gets sick a lot more easily. Also, Tysabri increases the patient's risk of a brain infection called progressive multifocal leukoencephalopathy, which is easier pronounced as PML. And this is really serious because it's a brain infection that if you contract it, it's fatal, and there's no way to get out of it. But sometimes this Tysabri is the only drug that is effective for MS sufferers. To treat the symptoms of MS, a common treatment is to prescribe a muscle relaxer because patients with MS often experience painful, uncontrollable muscle spasms, particularly in the legs, and so a muscle relaxant helps to improve muscle spasticity. There are medications which claim to help reduce fatigue, but oftentimes those medications make the patient's heart beat faster or make them sweat more, but they don't really reduce their fatigue. Another common medication, or other common medications include antidepressants, pain medications, and prescriptions to help control bladder or bowel problems that are associated with MS. Some of the on-the-rise treatments include physical therapy, where a physical or occupational therapist can teach MS patients stretching and strengthening exercises and show them how to use devices that can make it easier to perform everyday tasks. A new field in MS that's pretty exciting is stem cell transplantation, and it's being investigated. This is where doctors would inject healthy stem cells into an MS patient's body to replace diseased stem cells, but they're not sure if it's going to work or not. So today, basically, I've given you a brief overview of what MS is, who it affects, and some of the treatments that are available. MS is a terminal, debilitating disease that will affect the rest of your life. So now, if one of you, heaven forbid, is diagnosed with this disease, or you know somebody who gets it, at least you know what it is. It's an extremely life-altering disease, which is why I'm now taking an initiative to study this disease through my program, the undergraduate neuroscience program, as well as pursue medical school. I hope to one day be a clinician and impact the lives of patients suffering with MS. So I hope you learned something about MS today, and I will take questions if anybody has any.
I have a question.
Yes.
Actually, so I know like the microglial cells of the brain have been found to have some types of immune responses. So
They do. The microglia are safe. They are basically the resident macrophages of the brain. So the microglia are like your white blood cells who eat the bad stuff.
Yeah.
So they are safe. They're good in the brain. They don't cause any problems. They think it's the T cells that infiltrate and crawl. They're somehow primed to cross the blood-brain barrier, and they don't know how they're primed. But because your immune system is outside your brain and spinal cord, so they don't know how they're primed, but they somehow get in and an attack. Yeah, good question.
And also, some of the pictures that you showed of people with MS, like the disease region, so does that function, I guess, in its more developed stage, kind of like a brain or spinal cord injury where it actually goes cystic? Like, do you know if it does that?
You mean, do the lesions look like cancer?
No, I mean, like, if there's a brain or spinal cord injury, usually there's an astrocyte response and it actually forms a cyst, like empty space. I wonder if it does.
So the lesions, yes, they do sometimes look like that. So if a person were to take a scan of some MS patients' brains, there's a type of MS called tumefacts.